Okay, go ahead.
So, my name is Mason Gell, and my partner is Michelle Denning. We are assigned the topic of EMTALA. So, first we'll talk about what is EMTALA. EMTALA is the Emergency Medical Treatment and Active Labor Act. It is a piece of legislation that requires any hospital emergency department that accepts payments from Medicare and Medicaid to provide an appropriate medical screening exam on people seeking medical treatment, regardless of condition, age, gender, citizenship, legal status, or ability to pay. Hospitals are not able to discharge or transfer patients needing emergency treatment except with the informed consent or stabilization of the patient, or if the patient's medical condition is in need of a higher level of care at a different facility. EMTALA applies to every person, not just those who are covered by Medicaid or Medicare. The emergency medical care required by EMTALA is not directly covered by the federal government and has sparked some controversy as the unfunded mandate. Next is kind of the history of EMTALA and why it was necessary to promulgate this legislation at the time. EMTALA is an act of the United States Congress and was passed in 1986. It was passed under the Consolidated Omnibus Budget Reconciliation Act of 1985, or COBRA, that gave individuals rights of staying on their insurance plan after employment was ended. This legislation was passed so that hospitals would stop patient dumping. This refers to the refusal to treat people because of an inability to pay, or insufficient insurance, or transferring or discharging emergency patients on the basis of high anticipated diagnosis and treatment costs.
Right, and so mine's going to kind of go over, it's probably going to repeat a little bit of what Mason said, but it's going to go over some of the policies. So if the department or facility of the hospital located on or off the main campus is, so this is what would make it a hospital that would have to enforce the EMTALA policy. If it's licensed under the state law as an emergency room. Oh. I think we lost him.
Do you want to pull your portion up? Do you want to share your screen really quick and then?
Yep.
Off what you have.
Yep. Okay, so license under state law as an emergency room advertises that they offer emergency medical attention without needing an appointment to those that are coming in, or if during the past year has treated a third of their patients as an emergency condition, or there was no need to schedule an appointment for those patients. The EMTALA rules do not apply to those patients who go to off-campus outpatient clinics that do not provide routine emergency services. If the patient does not have an emergency medical condition after an examination, of course, then the hospital is no longer under obligation. If a pregnant woman comes to the hospital must do an examination, and if she's showing signs of labor, they have to then make the call to keep her or make a safe transfer to another hospital. But if they choose to keep her, they have to stay. But she has to stay until the baby is born and everything's complete. And then hospitals with specialized abilities must accept transfer of unstable patients. Cannot delay exam or treatment to ask for payment. And then next, I'm going to talk about what the state of Idaho Department of Health and Welfare is rolling in EMTALA. So the state's responsible for Medicare and Medicaid. So that means that they're they're responsible for making sure that hospitals have agreed to accept Medicare and Medicaid as payment are abiding by the EMTALA rules. Making sure that hospitals are not patient dumping, like Mason said. So that's our presentation on EMTALA and what we've learned about it. So.
Awesome. All right. Thank you so much for doing that. I'm sorry Mason dropped off, but we're able to work it out, so it's not a problem. EMTALA is a important have to ensure people get the care that they need when they go to the emergency department. You don't turn them away just because of their ability with that. So, good job on covering that topic. I'm gonna go ahead and stop the presentation really quick.